My sister's boyfriend was doing a gyno rotation. He was quite upset, as he was examining a woman that, from sight and smell alone, it was obvious she had cervical cancer so advanced that she wasn't going to make it. For the first time on that rotation, he had to warn someone about their imminent death. It was all very depressing and solemn, so it was quite a relief when it turned out to be a tampon that had been in there long enough to resemble a tumor. Eat it. On TSS, someone correct me if I'm wrong, but as I understand it, the bacteria that causes TSS is either present in a patient or not, like MRSA. TSS is not an inevitable consequence of disgusting tampon behavior.
My wife is an OB/G, Y, and specializing in maternal fetal medicine, which is basically high-risk patients. She had an obese diabetic woman come in with an abscess the size of a lemon on her labia. When they lanced it, the abscess exploded, missing my wife, but hitting her nurse. She described the smell as worse than 1,000 decaying bodies, and the nurse with over 10 years of experience proceeded to throw up all over the exam room.
I once had a roommate that was a nasty, unhygienic little troll. She was always funky, but at some point she just started to smell BAD. You could smell her rancid cunt from 2 rooms over. Stank up the house. The rest of us living there, 5-person party house type setup, all told her to see a gyno, and she just thought we were insulting her until the stabbing pain started. All the pot and pills she took wouldn't kill the pain, so he finally went to the doc. Same situation as you described. She had lost the tampon up there for months, to the point where it was black and rotting and causing massive infection. She nearly died, and would have if she hadn't gotten to the hospital when she did.
One of my friends worked as an intern with a gynecologist 2 years ago. There was a client complaining that she couldn't get pregnant. She also had been having diarrhea for a long time. The gynecologist asked if she regularly had anal sex, and the woman confirmed that she only did it anally. Apparently, her husband had told her you can get pregnant from anal sex, so she wanted it nonstop to get pregnant.
I'm no gynecologist, but I have cleaned oozing puss from a 70-year-old septic vagina. I was 21 years old at the time, and I'm a guy. Ex-GF's dad used to be in the field before retiring. Worst case he had was a woman who was a heroin addict. For whatever reason, she had to get creative with where she injected. Apparently, she considered her labia a good place. That was until they went gangrene on her.
My mom works as a gynecologist assistant, and she has told me a few stories. A woman once went in and apparently filled an entire room with her putrid stench. She had been wearing the same underwear for 2 months, and her panties, which were originally white, became a darkish yellow-brown. She apparently wasn't very good at wiping either.
I'm an EMT and work in free health clinics with remote area medical. We provide vision, dental, medical, and women's health clinics. I was assigned to the women's health area when we had a lady come in with a washcloth shoved in that region. Stank to high heaven, and she'd put it up there 3 weeks ago as homemade contraception. That was my first time working in the women's health clinic. And I have more such stories, such horrible, horrible stories.
Not a gyno, but was an EMT firefighter about 10 years back. Treated a very attractive woman who decided to dump about 4 ounces of Drano into on her vagina to kill the sperm that her date left in her by accident. Just think of an English bulldog who got popped an Alka-Seltzer, got into a Costco-sized jar of mayo, and then was punched in the face about 10 times. That's what it resembled. To add to the awkward factor, about a year later, I met a very attractive woman at a grocery store. Got her number and met her for drinks. Later that night, we ended up at my place making out. As soon as I started taking her shirt off, I suddenly remembered that the girl who I had taken out for drinks was the one who previously dumped Drano into her bag. Our night ended abruptly and awkwardly, as you can imagine.
This is a story from a friend's dad, happened 3 summers ago. An overweight woman comes into the office for an STD test and pelvic exam, complaining of colorful discharge, an awful stench, and burning during urination. She assumes she has gonorrhea. Wrong. It was much worse. He gets in there for the pelvic exam, all the while assaulted by the stench of rot, and finds a fucking dead frog in her vagina. This thing is heavily decomposed, since the warmth of the woman's vaginal cavity has helped to speed up the process, and he has to pull it out piece by piece. Needless to say, she also had a wicked UTI. The woman explained that she'd passed out naked and drunk/high/whatever at some party at her boyfriend's house, and figures he or one of his friends must have thought it would be an absolute riot to put a live fucking frog up her vag. She apparently did not seem bothered by the fact that an animal had died and decomposed in her vagina, just relieved she didn't have gonorrhea. Edit. For extra gross out factor, it's worth knowing that this was in Memphis, Tennessee, where temperatures routinely get well over 100 F with over 90% humidity. Think about that.
I'm a critical care nurse, and we had a prostitute brought in through the ER, and she kept grabbing towards her vagina, shouting she had stuff in there. We looked at each other and thought, oh no, now we gotta look. We proceeded to pull out toilet paper, $32.50, and a handful of maggots. Almost all of us gagged.
My sister is personal friends with her OB/GYN. I know, weird. But whatever, they're colleagues. She works in the hospital with him. Anyway, she asked him if he ever go sicked out by some stanky vag, and he said that he had not personally run across any that sicked him out, but that you bitches need to wash your fucking feet. LMAO. After that, I make sure to give the tootsies a good scrub down with the antibac soap in the exam room before the doc has to stick their face between them.
My aunt is a gynecologist, and she very awkwardly lectured me after a recent client had visited. Apparently, this girl and her boyfriend decided to get creative, so they used tuna and milk to excuse me, eat her out. The girl kept getting random orgasms in class and went to find out she had maggots. So gross. Just a tip.
Super late to the thread here. Not an OBGYN different specialty, but I've done my share of vaginal exams. I once admitted a 300-plus pound mentally handicapped woman to the hospital for some non-gyn issue. However, she had what I suspected to be a ragging case of bacterial vaginosis because her whole room smelled like rotten zombie vagina. It was so bad the nurses moved her to a single room and put a fan in her room to move some air. Unfortunately, this meant that I would, at some point, have to do a pelvic exam. I put it off the first day, which turned out to be a mistake. The following day, I showed up to check things out. The nurses informed me that her handicapped boyfriend had been in the room all day with the door shut. I walked in before the exam, and the room was literally saturated with the smell of vaginosis. It was so thick in the air, I swear it was precipitating on my skin. I get her all positioned and have my med students hold her thighs open for me. Yes, hold her thigh fat out of the way. I go in with the speculum. Her vaginal walls are collapsing around the sides of the speculum because of her size, making visualization difficult. She has an abhorrent amount of vaginal discharge, which was probably from her BV. At this point, I'm breathing through my mouth because I know if I so much as sniffle, I'll probably gag. The med students are looking away with a look of horror on their face, obviously having made the rookie mistake of breathing through their nose. In addition to her vaginal discharge, however, I notice what is very clearly semen. To this day, I still see her semen-filled infected vagina when I close my eyes.
While I was in the hospital waiting to have my son, they asked if the nursing students could come in. I expected a bunch of observers, but they had every single one take turns checking my cervix for dilation. A couple of the nurses were very attractive, and this one would put her thumb directly on my clit as she shoved her 2 fingers deep enough inside of me to check my cervix, which was painfully fantastic. All the extra blood flow to my lady regions made everything feel so much better. I wasn't dilating, so they started checking my cervix every half hour before calling for a C-section. It was so oddly arousing.